Hello, I'm Dr. Brad Holmberg. I'm founder of InvisalignDoctors.com. I want to show you a case that's a little bit tricky, okay? Because what it is here's the original. It's a spacing case, it's a deep bite case, and it's a case where there's lingual inclination of the upper incisor teeth. And the treatment plan here, the goal is to close all spaces. And these kind of cases are very common to, or it's fairly easy to finish with premature contacts and a posterior open bite after the initial set of aligners. So I wanted to show you something. First of all, there are no anterior occlusal contacts. Even though it looks really tight here, you don't see any even green marks. But I want to show you something. What I like to do is I always like to make the second molars unmovable. And if there's any little bit of shifting of posterior teeth, mesial, there, you saw that as soon as I did this, the whole upper right side went distal a little bit by just locking in the position of the molars. Now there can be no mesial distal shifting, but as soon as I did that, there's premature anterior contacts. So in this treatment plan, there was shifting of posterior teeth, the second molars at all the teeth, mesial to that, which was which was resulting in no premature contacts in the anterior. Once you remove it, because those movements are not predictable, you're going to end up with premature contacts. So how would you treat this case? Well, right away now, because all I did is I just canceled the movement of the second molars, I know that this case is going to require some relief in the anterior. So in spacing cases, I'll commonly just transfer some of the space. The existing space is right there. There's quite a bit. There's some already distal to the cuspid teeth. So if I explain to the patient that I think it's just okay to leave that space, we'll get rid of the rest of the space, but I'm just going to add that space back. I'm just adding back right now the amount that was there to begin with. Let's see. Sure, it was 9 millimeters. We're getting rid of the posterior spacing. We're getting rid of the anterior spacing. Now, once I do that, you can see that the premature contacts are gone. Let's look at the resulting overjet after leaving that space. Well, now we have some excess right here. In fact, we have anterior open contacts, and this is what you want to see in cases where there is, well, like I said, a deep bite, space closure needed in the upper anterior, and also correction of lingual inclination. Is there anything else I would do with this plan? Um, I would leave that space, and if you want to get a little more, you could just add a little IPR distal to the lower cuspid teeth, like right here. This is how you add IPR. A 0.5 millimeter increment of IPR distal to the lower cuspid teeth gives you pretty significant bite relief. And now you can see there's even more. So in cases like this, I'll usually add spacing. Maybe you want to back down the spacing a little bit because you added that IPR. You can just do this with the 3D controls, and then you can look at the result right away. Keep in mind, in cases like this, when there's a deep bite, and the retroinclination, lingual inclination, and spacing, usually the amount of overjet you see after the initial set of lines is less than what you see here. So I don't know. I'd probably go like this again, bring it back up, and I'd go with it. And then in refinement, after initial set of liners, perhaps I can adjust the amount of space that I left distal to the upper cuspid teeth. What else can you do to get a little more bite relief? Well, what you could do is if you unlock this space right here, you can just use labial crown tip, and you can actually procline the incisor teeth a little more. They're really retrocline, and there's lingual inclination to begin with. Just kind of work with this a little bit. That's torque. This is the one right here that you want. And you can actually create a better inclination. So you can improve that lingual inclination and create some bite relief by using, in addition to the torque, there's torque in those teeth. That's why there's power ridges. You could even use some labial crown tip. There it is right there. Buccal, lingual crown tip. You can see that there's a B for there's buccal crown tip. So I just wanted to point out that these cases can be tricky. And the first thing I always do is I always set the arches. Now, in this particular case, there's just a lot of, there's some blue movements. There's probably some unnecessary movements in here, but there's no anterior or posterior shifting because I made the second molars unmovable. I do this first, and then I work in the anterior versus working in the anterior first and not doing anything in the posterior and finding out that that there's going to be um, premature contacts. So spacing cases can be tricky, but this is how I would approach this case. I hope this helps you in treating your spacing cases.